Welcome, everyone. I am Dr. Indigo, and I hope you are as excited as I am. I was sitting here watching this just like you, and I'm thinking, wow, I am so fortunate to be a part of an awesome team that I will be introducing a little bit later. For now, if I'm correct, I believe we are going to do a quick poll just to get a feel for where you are coming from. See, we do a lot of marketing and we never know who's reaching our information. So if we can have a poll quickly, which will just basically ask, where did you hear about this? Then we will get started. So it asks, please select one or more options that applies. Was it social media like Facebook, LinkedIn, and so forth? Was it a Rotary Club? Was it our district action group? Was it me? Was it one of our panelists that I'm going to introduce you to? Was it another Rotarian? Was it a coalition partner? And you'll learn more about who are our partners. Or is it something else? Like maybe somebody did a smoke signal, or maybe you had deja vu or crystal ball or something. But how did you hear about this? At some point, I hope that we can find out or do a formal actual survey to find out what is the other and really hone in how we can better market and reach more people. Okay, so tonight is our second third Thursday talk on mental health. It's called Minimizing Confusion. Is knowing who to call for help as cloudy as who you should be speaking to. Are we going to keep the poll going? How long are we going to do the poll, guys?
I don't think you see it anymore.
I think there's a poll to guys around.
Can someone take it down, or do you need me to take it down?
I think you can.
So you had an opportunity to learn a little about me, but let me just share with you who I am from a mental health perspective. I've been working in the mental health space for many, many years. It is actually my passion. I have a doctorate in values-driven leadership with an emphasis on mental health and leadership. I've written for Inc. magazine, a mental health column, and I've also had a nonprofit called Indigo Insights. So what we're doing tonight is what I would consider my life's work. And you're going to hear from 4 exceptional professionals who work in the mental health space, who's going to help you understand more about our industry and how it impacts you and how you can leverage these relationships even better. You are going to hear from one of our leaders. Her name is Sadie, and she's an advisor of the Mental Health Initiative. I'm going to give you an opportunity to read a little bit about her, and then she is going to speak with you. Siggy, are you ready? Is she with us?
I think she's not in the room yet.
Yeah, she's not in.
Yeah. So probably you just you come back to this section later.
Okay.
Yeah. Thanks.
Okay. So tonight is about mental health and examining practitioners. There are numerous options to consider when experiencing mental health challenges. And right now, I would like to pose one more question, another poll, where I would like to know, did you join us for our last show? Because that would help me to understand how much should I share with you. If we have a lot of people who are new, I may have to emphasize a little more. So can we have the next poll? So in December, the poll was about mental health. So how many of you were with us on our third Thursday talks? Okay, as I'm looking, it appears that we had quite a few people who didn't join us. So let me just say this. What we talked about, and it was covered in the video, is that everyone has mental health and that there is a spectrum that moves from wellness to illness. And with the spectrum, you may at any point be happy, joyful, balanced, but something can occur in your day or in your life that can cause you not to be in that happy space, where you may have bouts of depression or sadness and so forth. And so because of that, I thought it would be wonderful if we could just stop and look at what are the various options out there. See, right now we have a lot of people who are struggling. And what's interesting is that you may be fine carrying, I'm from the US, so I have to use pounds, I don't know kilograms, but you may be carrying 100 pounds, 50 pounds, and that's okay. But if someone puts a job loss, which could be another 20 pounds, someone can put divorce, another 20 pounds, someone can put childhood, your child is sick, or you're moving, or you're being evicted. There are so many things that they don't have to be catastrophic. It could be as easy as you get a different job, which you would think you'll be happy about, but that's changed. So when we talk about things that happen in our life, it can cause us, I'm having a hard time getting to things, so bear with me, everyone. It can cause us to be stressed out. And so when that happens, we don't always know who to go to. Very often, many of us go to who? Our mom. We go to our dad. We go to our best friends. Some of us Rotarians go to other Rotarians. And what I will say about that is that, and actually Einstein said this, that doing the same thing and expecting different results is the definition of insanity. And what I mean by that is that very often we go to the same people who are unable to help us, who's unable to shoulder what we're going through, but yet we still go to them hoping to have a different answer, a different solution, a different perspective. So with that in mind, I have tonight with us a therapist, psychologist, psychiatrist, counselor. I'm a coach. There are peer coaches. There are different people out there, different professions that can help you on your journey. So what we're going to be looking at is what can be cloudy is knowing what it is that you need to do and who does what. We also need to look at when you need to select someone Is it just one person? Is it two? Is it a team of people? Not everyone can be your everything. And then the last part is to explore the distinct differences between those four professions, as well as the subtle similarities. So the first person I want to introduce to you is, unless I need to go back and pick up City. Dr. Dixon, is she in the house?
Not yet, not yet.
Okay, so maybe what we'll do is take a break a little bit later, and then go back to talking about Rotary, who we are, and so forth, so it won't be too disruptive, okay? So the first person I'd like to introduce you to is Sitra. And Sitra, I want to give you an opportunity to read a little bit about her, but let me tell you what I know about her. I met her through LinkedIn. Now, we may have ran into each other in other ways, but it's not until I saw her on LinkedIn when she gained a new position at the Mind faculty, and everyone was applauding her and thanking her. And I would just watch some of the things that she was saying, and I was like, I need this sister on Thursday, because I feel like she's going to bring to you a depth of knowledge about being a therapist that you're not going to get anywhere else. See, I want you guys to understand that these people aren't just laying around. We have to actually go and get these professionals who can spend time talking to us about their profession, but more importantly, how they can make a difference in your life, whether it's with them or someone like them. So Sitra, please introduce yourself your way.
Thank you, Dr. Indigo, for the kind introduction. And thank you, Rotary, for having me here. This is like a dream come true, actually, for many mental health professionals. And I should actually thank Dr. Bindi for stepping up and coming up with this mental health initiative. We have been trying to do that for many years, and it has never happened. For the first time, I think I'm so happy to be with all those professionals and doing something about mental health in Malaysia. So a little bit about me. I was trained in applied behavior analysis for, I think, about 5 years with supervision. And then I came out of it and I founded a company called Little Triangle Services. We were a pioneer company to do inclusion and advocate for placements in school for children with developmental disorder. I felt alone. Of course, I had Dr. Alvin sometimes with me to advocate for it. That's how I met Dr. Alvin, actually, and few other professionals. And having that company taught me a lot, actually, because I was alone. I had to advocate, I had to enlighten people, I had to educate people all by myself, and also empower a lot of people. So I think I appeared in a lot of media for, autism or just, advocating for mental health. And I think the best outcome was finally was heard by YB Hanayo, and she called the police to actually contact me, and I was involved in writing the SOP for autism. So that's about me.
Thank you so much. And you'll be hearing much, much more from her.
Sure.
The next person is my dear friend and troublemaker, and Dr. Ng, and he is over at Sunway University. Just an incredible, insightful guy. I mean, the stuff that he's going to be sharing with you all tonight, I'm excited to hear about. So if I can hear from Dr. Ng to just tell us a little bit more about himself.
Thank you, Dr. Indigo. Hello, everyone. Thank you for your time being here tonight. I must say that the profile that you see of me here in front of you, this was last year. And this year I've got a new portfolio. I'm no longer the head of department. of Psychology at Sunway University. I am now the Associate Dean International of the School of Medical and Life Sciences. Much more fun position because I get to celebrate people and what they do that's good. And yeah, basically celebrating people, which is very good for mental health because you're focusing on the positive and net positive psychology. A bit about myself, I'm very passionate about mental health literacy. I like talking about mental health to all kinds of people because it's important. And it's even more important for all of us to see mental health just like physical health, and there shouldn't be any stigma talking about it, which is why I'm here. And thank you, Dr. Indigo, for having me.
Thank you for being here. It's my absolute pleasure. And he also goes by Alvin Owl. Is that how you pronounce it?
Well, I've got this character that I draw, especially when I'm stressed up. It's an owl. It's a cartoon owl. So I named the owl Alvin. Yes. Yeah, you can look for me on Facebook. Some of the owls for what do you call that? It's not just for friends, but it's general, so you can view it. Otherwise, things are private. Yeah.
Cool. Next, I have Azah. Some of you may actually recognize her. In a little bit, she'll talk a little bit more about her, but here is her profile. And I think what I would like to say is that when she and I first met, we were on the phone as if we knew each other since childhood. And I said, girl, this is what we need. When we get on the Thursday, let's just talk like we're talking now. The woman is just phenomenal. And I think you're going to enjoy hearing some of the things that she has to say about mental health and her practice. Azah, I turn it over to you.
Hi, everybody. Yes, we were just like old girlfriends, weren't we? Yeah, I was, if you can read quickly what's on there, I was a TV presenter way back when and in another life. Retired from that, I guess, and retrained as a counselor here in Malaysia. And yes, I'm a registered and licensed counselor in Malaysia, as well as in the UK. I'm under the BACP, the British Association for Counsellors in Psychotherapy. And so one of the reasons why I went into counseling, other than my mother's also a counselor, that also helped. I saw a lot of things in my media career that related to relationships, that related to how people were talking to each other, getting upset and all those kind of things. And resulting in a lot of mental health issues, depression, anxiety, learning difficulties and all that. So when I went into counseling, I didn't know head or tail of what I wanted to do as well. And so slowly, with Mom's help, slowly, I kind of niched down to couples counseling, because I think that's kind of where a lot of things start, you know. If mom and dad isn't good, children aren't good, they grow up to be mom and dad, and then mom and dad aren't good, and so on and so forth. So yeah, I work primarily with EFT perspective, emotionally focused therapy, not the tapping bits. I do that sometimes, but mostly emotional focused therapy. And yes, I also founded the Malaysian Marriage and Family Therapy Association here in Malaysia, and one more that's in the works at the moment. So talking about mental health, talking about relationships with each other are my passion as well. So yeah, I think I'm in the right place with everybody.
Wonderful. And what's interesting is, even though I've been in this space since the early 90s, when she and I were talking, and you'll probably remember, I was like, oh, I want you to talk about being a therapist. And she was like, yeah, nah, I'm a counselor. And I was like, but you got therapy in your name. So it'll be interesting, because if I can think she's a therapist with a psychology background, I'm sure a lot of people are just as confused. What is the difference? Okay.
And to be honest, I was confused in the beginning. So let's find out, okay?
And if we don't solve it tonight, we'll be confused together.
We're good. We start the conversation though.
Now, we have this saying in the US, last but not least. And I actually don't like that saying, but now I understand it because I want to introduce you to one of what I would consider, aside from him being just this gentle giant of a man in the psychiatry space, Dr. Kadir knows his stuff. I mean, he really knows his stuff. And I can sit with this brother for hours, which we have, in his office, in his home, in Starbucks. And I know he's probably thinking, oh my God, this is Indigo calling again. If I get on the phone with her, I'll never get off. But he is such a giving brother in terms of his knowledge in this space that this would not be complete without him. So I'd like to introduce you to Dr. Kadir. And take it away, Dr. Kadir. I know he's here.
Okay, now I'm muted. I start my video. Okay. Right, I'm the old man in the group. Or young therapists. I wish I had you guys when I started psychiatry many years ago. I started doing what you have been doing many years ago alone. So I can share Citra's views as well. We actually once cycled all over Selangor and distributed mental health pamphlets to every village. Those were the days. So basically, for tonight, I'm a psychiatrist. I've retired from government service, but I'm focusing myself on two specific areas in mental health. One is working with families of people with serious mental illness, and then working with peers, people with lived experiences. So I think that I will focus my discussion today on that. So I'm a psychiatrist. What we do is that we are trained doctors, medical doctors. Then we go into psychiatry. So my time in the 80s, we had to do everything. We were trained in psychotherapy. We were trained in family therapies. So we had to do everything because in Malaysia, we didn't have other mental health professionals at that time. So the coming in of clinical psychologists is the late 90s. Counselor, the counseling board, I think was registered about 2005. So we had little input in the early days with a multidisciplinary mental health professional team. Now, just before I retired, then I got all those. I had counselors, I had clinical psychologists, I had occupational therapists, I had social workers, mental health social workers. So then I had to retire. So now I'm back alone again, and I'm focusing on, as I said, two things: working with families and working with people with lived experiences. I think that's one of the group that's not in this discussion.
Mm-hmm.
Thank you.
And it's interesting you would bring that up because I believe we do need to have that type of conversation. What's interesting is that tonight, it almost, someone said, well, this is more clinical. The people you have are clinical. Well, in some aspects it can be, but some therapists are not clinical. Some therapists may work in have come through other doors. Or like, I don't consider myself clinical, even though I've taught psychology and I have a background in psychology. But I think tonight we are really focusing on individuals whom, one, if you have insurance, you can see them, whereas very often when you talk about peer-to-peer, you can't. But we'll also, because you brought it up, Dr. Kadir, let's definitely bring up some of the things because that is an option for people. So let's get started. I wanted to ask or start off by asking Azah, did I say correctly? I call you everything different each time.
Yeah, people in the West call me Azar, and it's Azar, Azar, or Azar. That's what they call me over here in London. But it's Azah.
Azah.
Yeah.
Let's start with you.
Mm-hmm.
What is the distinct difference between what you do
Mm-hmm.
and what the other panelists do?
What's the distinct difference? I know what I do. I'm a counselor. I do talk therapy. That's what I do. Educationally, I had to get a license in counseling. You have to have a degree in counseling of sorts, according to the Counselors Act in Malaysia. So our profession in Malaysia is regulated under an act, and we have the Board of Counsellors Malaysia. So that's why I call myself a counsellor. To be a counsellor, you don't have to be a doctor. You don't have to be something prior to this. This is actually my second career as a counsellor. So when I wanted to go into this counselling or helping industry, I either wanted to be a coach or I wanted to be a psychiatrist, but then oh no, you know, I take 7 years to be a doctor first, and I'm already in my 30s, so that just didn't make sense. And so yes, I couldn't do psychiatry, but it was so interesting how psychiatry works. And so yeah, the route that I went through was counseling. And why I chose that, because I saw my mother brought me into counseling when I was 19. So I saw how counseling works. What the other people do, I am not sure. I think it's more to the brain and the function of the brain. Correct me if I'm wrong. What I do is talk to you about your relationships with each other. And so I'm talking about your past, your trauma, and how that past is affecting your behavior and your relationships today. Coaches, I believe, is once you've healed from your past and traumas, it's moving forward in life. So I don't do the moving forward bit, I pass them to the coach, because now you're all healed from myself. So you know a little bit yourself is more congruent, you have a lot more confidence, in your relationship. And so where do you go from here? So that's kind of where I think coaches come in to help out. So yeah, that's my little bit there.
Okay, then let's ask Sitra, because if we're talking about the helping relationship, and you're a counselor, she's a therapist. Sitra, tell me about being a therapist. How do you fit into this whole mix?
Unmute yourself, Sitra.
Mute yourself. Unmute.
Okay. Can you hear me now? Okay. So I think anyone who did like a training or supervised training in a specific therapy method could be called a therapist. Even a psychiatrist, a psychologist, and a counselor are called a therapist, psychotherapist, or anything like that. So as for me, I think I just gathered, I accumulated more hours in therapy. It was supervised, and yeah, it was 5 years to become a therapist. But in Malaysia, there is no body or any laws to say you can't call yourself therapist or you can call yourself therapist. Like what Azah just said, in counseling, we do have a body, but for any other things, we do not have a specific body. So for me, I think anybody can be called, like you can be an occupational therapist, you can be a speech therapist and stuff like that. So for behavior therapists, what I do is when someone comes in, a client comes in, like Azah passes me a client, yeah, she has done all the counseling and things like that, but I would work on a specific skill that they need to develop to actually, cope with that that situation. Okay, and some of them, you would be surprised, they actually maybe have like autism, even in their 40s or something. They never knew they had it, and that's why their communication skills are like off. They can't be in a relationship. But what do I do then? So what do I do is actually teach them, literally spell it out to them, like how do you actually communicate? It could be visuals, it could be verbal, it could be showing them, role playing with them. It could be, you know, having videos to show them how do you communicate, and then it gets better. But so a role of a behavior therapist is actually to teach them skills rather than go around it and say, oh, you know, you can just be on medication or something and just get over it. But where I work now in the mind faculty is something that I've always wanted to do, is working with a psychiatrist, a counselor, psychologist. So what happens is before I actually take in, if it comes from a psychiatrist, he's already given me an overview of like if the patient is on medication or the patient has, you know, a disorder or anything like that, and then I start working on it. But if the patient comes straight to me, behavior therapy actually do not need a diagnosis. You can just come with anger management. You just say, I'm just getting angry all the time and I want to just change my behavior. And by right, actually, we do not see a diagnosis. We just work on the behavior. But what I do is, because I have my master's and I have a lot of training in mental health, so I would analyze the whole situation. It could be something like what Azah said, coming from their past, mostly childhood traumas. So then I would pass it, and sometimes this childhood traumas is actually interfering with their memory. So they come in, they say, yeah, they have anger. Then I feel it's anxiety plus, you know, some kind of OCD or some autism there. But I wouldn't know why are they acting like, because they're forgetting so many things. Then I would just pass it to a clinical psychologist to do more assessments, to see the scores, and then come back to me for therapy.
Okay.
That's how it works. Yeah.
That kind of leads to Dr. Alvin, because what I'm hearing is that you specialize, you kind of drill in deep to help them change behavior or deal with something that they're coming with. While Azah, I didn't say it right, love me where I am, she would be more, maybe even long-term of healing, of things that have happened in their past that they're carrying with them. So you mentioned a clinical psychologist. So we have a psychologist here. How do you fit into this whole picture?
Well, how I fit in, like what Sitra mentioned just now, I'm the guy that you send to, that you refer to for assessments, psychological assessments. And that's what we are trained in. In terms of mental health training, our main niche, our skills are psychological assessments. So we are the ones who will be giving you all kinds of tests to figure out what you're good at, what you need to improve on. And from there, we do even more investigations. We basically do kind of like CSI stuff, right? And our CSI is basically cognitive scene investigation. It's not so much criminal scene, but although we can also work in the forensics, but that's a different story. So yes, we are the ones who assess, and from our assessments, we come up with a list of recommendations of what can be done by all sorts of people: psychiatrists, counselors, behavior therapists, occupational therapists, speech therapists, all other kinds of therapists, maybe even, I don't know, beauty therapists, massage therapists, you know, they work too. Yeah.
They work well for anxieties.
Yeah.
Oh, yeah.
Oh, yeah.
We hear
Yeah. If you have got anxiety, go for a massage if you're not too ticklish. It works much quicker than meditation, which may tend to give you even more stress, you know. Empty your mind, empty your mind, empty your mind. No, it doesn't happen. So yeah, technically we are the technicians. We are the ones that whip you into shape in a way. We are pretty much like kind of like behavior therapists as well. We're not as nice and fluffy as people like Azah. You know, counselors are very nice, fluffy people.
Yeah, with
Exactly.
fluffy fuzzy dot people. But what the other flip side of that is when people come to me, I have a counseling psychology degree. And I've also got, I just passed, hey, my master's in
Congratulations.
psychology. Ha-ha. And
Congratulations.
so, thank you. So now I'm able to identify symptoms of whatever's in the DSM. You know, I'm able to look at the DSM is the Bible for kind of what's happening in your head. So, but that's just a suspicion for me. I can't assess, and I can't do all those things that Alvin and Sitra can do. So when I say this, when I see symptoms and I'm guessing, I'll probably call them both, and I'm like, hey, maybe, I don't know, do you want to, can I refer to you, please? And so I will refer to them. I don't, as counselors, we don't have that skill that psychologist has. So I can identify, but I'm not sure. So that's when I refer.
Okay, so with that, I like to bring in Dr. Kadir because he doesn't do guesswork. As a psychiatrist, he's able to diagnose. That's a huge part of diagnosing. As a matter of fact, I sent someone to a psychiatrist once, and they came back angry, very upset, because they were used to me being the coach, you know, coaxing them and helping them and cheering them on and taking notes. And when they went to the psychiatrist took some notes and gave them a prescription. Oh, they were livid. They were like, he didn't talk to me. He just took notes. Well, I want to hear from Dr. Kadir. What is it that a psychiatrist does that's different than the other three?
Thank you very much. Okay. Basically, when someone comes to see a psychiatrist, what you do is you take a full history of all the problems. You understand the childhood trauma, you understand the grief, and you try to put it all together. We understand most psychiatry issues stems from social determinants. So we put it all together. If you have the luxury of a multidisciplinary team, then you start referring the patient to a social worker to help investigate into the social issues, to a psychologist. If you have that luxury, I can tell you in Malaysia, we don't have that luxury. How many psychologists are there in the government service? 16.
There's more now, actually. There's 31.
No more now.
Yeah, 31.
Wow.
But still,
Okay, 16
31
to
is
31.
very, very little in population of
Yes,
32 million. Yeah.
35.
Yep. You need 800, so 31. Not bad. When I became the psychiatrist in 1991, I was number 13, 13. Now we are up to about 400 something. So calculate yourselves, 1990 to 2020, from 13 to 400. So you're not 31. You need another 30 years to get to 400. So anyway, I'm getting to that point because in a rich area like Klang Valley, you have all those people like Azah, Sitra, who you can go to, you know, even as first line. When I worked in England in a community mental health team, the head of the team wasn't me. The head of the team was an occupational therapist. A clinical psychologist was there. I handled the severe end of the spectrum, which is the bipolar, the severe depression, the schizophrenia. But I was a member of the team. And because I had, being a Malaysian psychiatrist, we had extra training. We had to do psychodynamic therapy. We had to do cognitive therapies. We had to do family therapies. We don't have others at that time. So when I went and walked into England, I had that extra skill sets. And later on, I joined behavioral family therapy group with Groene, clinical psychology. That's for people with schizophrenias actually, and bipolars. So that's what we do. We see people who have mental health issues. We try to understand it in a holistic manner. Sometimes they need medication. Sometimes they need talking. Sometimes they just need to talk. Like say, for example, most of the time I see now in private practice are those with grief issues. Okay, and I give them 3 basic messages. It's normal. It's time constraint. You need to write with the time. If you can't do like Alvin says, meditate or do some religious practices, then you need some medication for a few days. So that's what the psychiatrist do. So basically what the rest does, the psychiatrist does that first. I have to correct Azah, the DSM is not my Bible.
Wow.
Okay, it is not.
ICD
Is it
10.
CD?
ICD-10?
ICD, we are trained
Okay.
differently.
Okay.
Those are just symptoms checklists.
Yes.
Yeah.
They are symptom checklists,
Experience.
basically.
That's right. Yeah.
So they are not even a diagnostic manual. But in America, you have to fulfill the DSM for insurance purposes. For
Right.
Malaysia, no, we haven't come to that yet. Before you touch in, there's only one company that covers mental health reimbursement, and they will reimburse to Alvin and me, not to Azah and Sitra. That means to a psychiatrist and a psychologist. They haven't written down registered counselors yet. So AIA is the only one, and that's only for outpatient treatment. They don't reimburse the medication. So those
Yeah.
are things that we need to talk about later.
Wow.
So anyway, just to sum up, a psychiatrist see a patient, get a holistic view of his issues, understand that social determinants are very important in mental health issues. And when I was in Permai, we work in a multidisciplinary team, so we accordingly allocate the patient to those who have the best skill sets to manage. Unfortunately, in a government setting at that time, even now, the skill sets are not held by many. For example, family therapy training, there's only a handful who can do this. Cognitive therapies, a lot of psychiatrists are able to do this now. Dialectic behavior therapies, I've trained quite a number of people. So to me, that's the biggest issue in the public service, that we have very few professionals who can deliver services that we know these are available, but not accessible to the general lay public, the B40s and so on.
So
Thank
let me
you.
ask you this, the four of you. I agree that it's very confusing. So I got a better feel now that each of you have spoken, but what would you recommend as an indicator for someone to select you? For instance, if I was like, let me just say, there's a difference between sadness and depression. We all know that, right? Amongst us. Sadness is, we know where it's coming from. Sadness is, I lost my job, my dog died, you know, I broke up my girlfriend. I don't get to watch Netflix tonight, I'm sad. Depression is when you can't really determine where is that coming from. It's a level of sadness you can't even explain. So I believe right now, a lot of people are probably depressed. A lot of people are probably sad. There are people who are angry, resentful, just a lot of emotions all over the place. If someone is out there watching right now and they don't know, how do I even know who to go to? What would you say to them? And I'll start with Dr. Kadir. How would someone know to come to you? What would be an indicator?
Okay. When I was in the public hospital, I say don't come because my workload is overwhelming above my head. In the private side, if you can pay, you can come and see me. I'm quite well known. But what I would say is that care is first self-care. You start at that first, self-care. So if you're feeling sad, self-care first. So it's about coping skills, finding your circle of support, and getting good sleep, exercise, good diet, knowing methods of relaxation. That's self-care that you need. And there is a cutoff in a DSM, Azah, it's 2 weeks. If you can't care for yourself after 2 weeks and you're still non-productive, you're working, you go to work and come back there, that's fine. You may feel, you may use the word depressed, but you don't have what I would look for, melancholia, you know, the quality of depression that doesn't lift up. So that's number one. Okay, number two, as I said, if you've got, if you are able to pay for it, then you can see anybody. Actually, you can talk to Azah, you can talk to Sitra, you can talk to Alvin, you can even talk to me. Although I'll get bored because I've done this for 40 years. Right? Let others do that. So I'll give you a piece of paper with the wellness strategies. Go back and do this first. Come back and see me in 1 month time if you think you need medication. If not, I'll send you to a few others who will listen to you. That's number one. Number two, I think the second part of self-care is I think the support. So if you, unfortunately, even in Malaysia, we have people with very low support systems. So that's where the peers come in. The peers are people with lived experiences. Lived experience means if you have a depression, you've gone through grief, or you have overcome childhood trauma, and you get yourself in a group and you offer this help to those people who needs help. So I think that's the second level. So self-care and then peer support, those with lived experiences. And only then you go upwards to look for care. And the third level, I feel, is not the professionals, but to train people like Indigo who has skill sets, other volunteers in what we call as psychosocial interventions, basic cognitive cognitive led or behavioral led, etc. Interventions that are generic. For example, cognitive led will be thinking positive psychology thoughts, or even cognitive processing, how you process thoughts. Behavior will be behavioral activation. You get involved in societal activities. Unfortunately, now in COVID time, you can't do that. But in the there is a study done in Kurdistan where the man died. The woman at home will be encouraged to join wedding parties, would be encouraged to join the weekly religious festivals in that particular town, and it helped them. So behavioral activation, cognitive processing at a lower non-professional level, train a group of people to deliver this at the community level. So at the health centers, at Rotary centers, where people can come and you can deliver this without much diagnostic interventions yet. If that doesn't work, then come and seek help. So the pathway must start with self-care, peer support, psychosocial interventions, and go upwards to specialized care.
Okay.
Okay.
Let's hear from Dr. Ng. What's an indicator that someone would have to come to you?
Me, well, usually, like I said earlier, if you need to have an assessment, for example, a cognitive assessment, some people call it an IQ test, but it's a pretty comprehensive test to do so that you find out what's going on within you, psychologically, because we are able to test your level of attention, your focus, how well you problem solve, things like that. We can also assess for emotional level, your behavior. We can do observations, all kinds of stuff, because that's what we are trained to do as psychologists. Now, that's one of the main difference between a psychologist and a counselor. A counselor, like I said, are nice, fluffy people. They listen to you. They manage, help you understand your emotions, manage them. Whereas we tend to be more of the taskmasters. We get you to do stuff, give you homework and stuff so that we learn more about you. But we are also trained in therapy. We can also be called therapists. I mean, somebody just private message me and ask me, what's the difference? I said, well, coming soon. So, I'm also trained in counseling. I'm able to do psychotherapy. I'm able to do cognitive behavior therapy. Just like what Dr. Kadir was talking about, we are all trained in certain kinds of clinical competencies where we are able to help. So back to your question, Dr. Indigo, if anyone has any kind of, for example, concerns about depression or anxiety, actually they can see any one of us. But it just depends on how much money you are willing to spend on. Like what Dr. Kadir said, if you want to come to private, we are super expensive. You want to come into private and you need medication, that's even more expensive. Now, speaking of medication, the difference between a clinical psychologist and a psychiatrist, a clinical psychologist like myself, we don't do drugs.
Neither does counselors.
And neither do the counselors. Yeah, we don't do drugs or vitamins. We don't do vitamins.
I hope you don't do drugs. You should be prescribing medication.
Oh, there you go.
Okay.
That Dr. Ng is that there is a very well-known noted psychologist who ended up with a drug addiction. And people would say, how did he not know? He's a psychologist, but he's not a psychiatrist. He didn't know the types of drugs he was being given, that they were so addictive. But that's a whole other story. But I think very often people think that if you work in this space, you know all the different nuances, and they are slightly different. So I think I like what you said, that sometimes it's about the money. You know, if you have the insurance, you can see Dr. Kadir, whereas you may not be able to see someone else. Let me ask, how would someone get to you though, Alvin? Like for instance, would Sitra refer someone, or Azah, or would a school
Right.
counselor? How
Okay.
would someone be in front of you?
Yeah, firstly, I must say that I'm no longer practicing, so don't come see me if you've got problems. I'll just refer you on. I'm more of a call center these days. But let's say you're thinking about a clinical psychologist. How would anyone get to see a clinical psychologist? You can go directly. If you are looking for a clinical psychologist in the government sector, you need to get a referral, usually from the psychiatrist or from the medical officer, but usually the medical officer will refer to the psychiatrist first for psychiatric assessment, and where there's a need for psychological follow-up, psychological therapy, they are likely to refer the individual to the psychologist, usually for further assessments, and then therapy. It can be behavior therapy, like what Sitra does, can be cognitive therapy, or both, or they can also be involved in behavior activation, like what Dr. Kadir was talking about. I mean, it really works. We look into the research literature. Behavior activation is one of the best things you can do, because you go back into the community and you just function. So yeah, you can come to see me directly. Yeah, sorry, don't come and see me directly. I'm in the university, you see. But you can go and see a clinical psychologist directly. Be aware that they are able to do assessments. They're the only people who can do assessments, basically. Psychological assessments. Psychiatrists will do psychiatric assessments. Counselors will do counselors assessments. We've got their own assessments. But clinical psychologists are usually in a hospital setting. That's why we're called clinical psychologists. We work together with a team of other mental health professionals, other allied health professionals, because that's how we can work. If you ask me, I rather work in a team, because alone, I'm pretty useless. There's only so much I can do as a psychologist. So yeah, that's how you can get to me. I'm into psychologists. You can go directly, or you can get a referral. And I would suggest that you see a psychologist who is well coordinated with other mental health professionals, because, as we can see here, there are 4 of us. Azah does the counseling. Dr. Kadir can do pretty much everything. But usually the psychiatrists are the ones who prescribe medication, and they would help you monitor the medication. The psychologist will not be talking medication unless there's a need to understand behavior changes or lifestyle changes that has to be made because of medication. Because some medication gets you very sleepy. Yeah. Somebody hand me something. Anyone with a dart? Poison? Tranquilizer dart? We're just talking about medication. Yeah, it makes you sleepy. And if that makes you sleepy and you have to function at night, there are certain changes that you have to make. So someone like Sitra will probably help you with a behavior change, or someone like me, a psychologist, can also help you with it. So there are lots of overlap between us, just that it depends on our training, our competency. I would rather go for competency rather than label.
Yep.
Yeah. But usually when it comes to medication, psychiatrists, assessments, psychologists, counseling, the counselor, and behavior change, behavior therapists.
So
in between.
So let me kind of go and focus on Sitra and Azah, because it's very clear what a psychiatrist does, what a psychologist does. But let me focus on you two, because I find that people still avoid sometimes seeing a therapist or a counselor, and they go to their mom or their friends, people who are woefully not prepared to help them with actual emotional distress. And so, one, I want to ask you, why do people choose friends or social media even as their counselor or as their therapist versus coming to someone real? And what can they expect when they come to see you? I'll start with Azah.
Sometimes they go on Facebook and do the pseudo, what is that, Alvin? I don't know, that thing that they
You mean the glossy magazine?
Yeah,
you know, tick, 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 tick,
tick, tick,
and they
tick,
go, oh
tick.
my God, I'm OCD.
Yeah, oh, I've got autism. Oh, help.
And the next month, you've got something else, because every month they've got a different list.
Oh, is it? And then different symptoms. And a lot of my friends do that as well. They go like, oh, Azah, I've got this. And I said, okay, so what test did you do? Oh, it's in this magazine. Okay. You know, it's very difficult sometimes, because I guess for counselors in Malaysia, a very different experience for me in the UK. But for counselors in Malaysia, when they hear counseling, they don't understand the word counseling. Counseling in Malay is the same pronunciation as it is in English. I think the first experience of counselors from people who speak to me are counselors in schools. And usually when you are a naughty person, a naughty boy or a naughty girl, you get to go to the counselor. And then that has that label, and that experience in itself, or trauma, if we can say, is very, it's in their heads, and they just don't want to see a counselor. I've had experiences where I've been said, oh, I thought you were going to tell me what to do. I guess they hear that all the time. I also feel and experience that people think that counselors are somebody that tells them you're doing this wrong, you're doing that wrong, And so it's not, I don't want to hear what I'm going to do wrong. I know what I'm going to do wrong, right? So why am I here? Why do I need to go to a counselor? And especially if I say I'm a couples counselor, if there's also a vernacular misunderstanding, in the sense that when you say couple in Malay, it's boyfriend and girlfriend. It's not marriage counselor, it's not a relationship. So there is a lot of, vernacular confusion amongst the community as well. So I have to advocate. I've been on TV, I've been on the radio, I've been on all these things just to clear all this up. And it's hard, isn't it, Sitra?
Yep. Yes. Okay, so am I in the same question?
Yes.
So, yeah.
Yep. Okay, I think for me, people are just not, you see, we go to a hospital since young. When I was a child, I would have gone to see a doctor and stuff like that. But growing up, I never saw any mental health professional. So I think long before, it has already been like, okay, someone who goes there, they are psychotic, they are crazy, stuff like that. So we try to avoid saying that we are going to a psychologist or a psychiatrist. So it's not normalized yet, I feel like, I think probably Azah already said so many things. I think that's it.
I think I also feel like sometimes, and I thought this was over, but it isn't, because I still experience this with people. Like, if you say that you have, I don't know, I'm just going to pick out something, ADHD or depression, or if I sit next to you and breathe the same air, I will catch it too. So, sort of thing. And there's so many misunderstandings, so many, all these, old wives' tale that just needs to be broken, and really normalize what mental health is all about. We're talking about the brain here. We need to look after the brain. We need to look after our bodies, and we need to look after our relationships. That's what all of us do. And we're here to help.
And probably it's not physical. We don't see it physically. So
Absolutely.
It's harder to actually notice that you're actually having anxiety or you have something, So it's harder to notice people around you or even yourself. So you learn how to cope with it and not saying things that, you might be experiencing. So but I do have a lot of teenagers coming to me and saying that their friends were the first one to tell them they are, caught themselves harming in the toilet and stuff like that. And then they told them to come and see a therapist. So when they come to me, basically, when I call their parents and stuff like that, you'll be surprised. Sometimes the parents are actually depressed. And this is when I send to a psychiatrist and I say, you need to manage the parents and I'll manage the child. and we work in a team, and yeah, we update each other and say what's happening, are the parents cooperating with all the therapy, and the child is getting better and stuff like that. So I think that was one of the best outcomes that I've actually worked in a team. So if I worked alone, I wouldn't have access to a psychiatrist. I wouldn't have access to a clinical psychologist. Clinical psychologist, it's always about finance. People do not have enough money to go and see a clinical psychologist to do all the assessments.
We are very expensive
So-
creatures.
Yeah, so probably they would just see a psychiatrist. And just like Dr. Kadir, I work with Dr. Stephen and Prof. Philip. They have been like in this industry for very long, and I think they've been trained for like almost everything. So these people, they know when to refer the case to me, or I would know when to refer to them, and they can just tell me each diagnosis. A person has OCD, anxiety, pica, eating disorders, whatever. They can just tell me what is it. But sometimes I still, if the parents have enough money, I'll just say, go to a clinical psychologist, let me get this approved, and and then see which area I need to work on, because there's so many areas. IQ, or probably their IQ can be high, their functioning, their verbal functioning, everything is like a 19-year-old teenager, but emotionally and whatever not, they are functioning as a 9-year-old child. So then it becomes an issue as well.
Okay.
The parents think they're actually grown-ups. They can, do everything because he's so smart, right? But they don't realize that he's still a 9-year-old kid functioning, and they need to speak in different ways. So then we have to teach the whole family. And sometimes it's not about teaching skills, but educating them. So then counselors or I can do it.
Yeah. And so that's where the counselors come in. Sorry, can I just jump in? So that's kind of where the counselors come in support. Yeah. We do talk therapy. So you can talk your head off to me and I will listen. And I will break it all down and give you a different perspective or reframe it for you in support. Because sometimes when we speak to our peers and people who do not experience the same thing as your little family does, it's good to have a listening ear that understands. You feel supported. When you feel supported, you feel heard, you feel seen, you understand that this is a problem, you are better able to be part of the team, the family team, with the other team outside of you to help whoever that's in your unit.
Okay, so there are some questions that I want to get to the questions. And so while I'm getting ready to look through some of the questions, I'm going to pose another poll that Sitra actually touched upon, which is when she was younger, she never considered going to a professional because people would think, oh, what's wrong with you to go to a professional? And unfortunately, even today in 2021, there are still stigmas attached to going to professional. And so can I see the next poll? Which service seems to have, it's cut off. Mahan, can you help me out with the question?
Yes. Okay. Which services? Yeah. Okay. Which services seem to have the least stigma attached? So please select one option that applies. Thank you.
Thank you. So what service seems to have the least stigma? Is it counselor? People are willing to go to them easily. Is it a psychiatrist? People are beating down the doors to get there. Is it a therapist that has the least stigma? Is it a psychologist? Or is it all stigma? All of them have a stigma attached to it, or none of them have a stigma. Everything is hunky-dory. Everybody likes getting help. There's no more stigma. So while that is running, I'm going to take a couple of questions and put them together. Even though they can't see your beautiful faces, they'll hear your voice. And what I would like to ask is, based on what you do, what would you recommend for someone going through a storm right now? What I mean by a storm is that the pandemic is a storm. If you lose your job, that's a storm. America The whole Trump thing a couple of weeks ago, that was a storm. And so we all go through storms, but sometimes we're hit with a perfect storm, meaning so much comes at one time. So if that is the case, from your professional standpoint, someone mentioned aromatherapy. I believe strongly in aromatherapy, love aromatherapy. I usually have it right here and I will spritz myself, especially if someone starts really getting on my nerves. I know spritz and that little, the smell and everything stops me from saying what I really want to say. But for you all, what do you recommend when people are going through a storm that we all seem to be going through? What do you recommend? Let me start with Azah. Did I say it?
Yeah, Azah, self-care.
Self-care. What does that mean? What does that look like?
Like what you did just now, aromatherapy could be one thing. Aromatherapy is not medication, by the way. It is a form of management of self. It's I do some aromatherapy sometimes as well. But whatever self-care that you can do for yourself, it could be a bath, it could be a shower, it could be speaking to people. Alvin has Alwyn, which is fabulous. I love him. Yeah, I write. I don't write online, thank goodness. I write in a very private book and just take out all my stuff in there. In through writing. So it's, first of all, it's just self-care. Find out what it is, and it could be by yourself or together with people that you're closest. I have some close girlfriends that I rant to, and then I go, but I warn them, I'm ranting now, and then they will just listen. And then I said, okay, rant over, who's for ice cream, sort of thing. So it's a lot of self-care, whatever that, if you don't know, find out. That's the first port of call, I think.
Okay, Alvin. I think she alluded to what you do, but what would you like to say?
Well, same thing, self-care. Go within, because the only person you're with at any time is with yourself. I just had a look at the chat, and what I saw here that's written by Allen Enghoy. Transfer your emotions into a medium like writing. I do that. I write. If I'm not able to sleep, I'll just wake up, go to my notebook, and if it's too dark, I go to my phone and type something in my notes. I write poetry.
Okay.
Yeah.
Excellent.
To express myself, I can express myself through drawing. These are just my own personal preferences. I like to exercise. Being in lockdown, there's nowhere you can just run amok. So you do that at home. Whatever floor exercise I can do, I'll just do them. It's pretty healthy. It's good. Keeps me like all chiseled and stuff. But yeah, self-care. Do whatever that helps you get comfortable. If you're not used to meditation, don't force it, because it can be too cliche. You should go into meditation. Yeah, it works if you have practiced for a long time. But, if aromatherapy helps, yeah, by all means go ahead. Anything that helps you feel more relaxed. So I would say do something that helps you to relax, to calm down. Move away from the storm, however you can. It's easier said than done. It's always easier said than done. I would think about whatever that you have done before that has helped. So go back to whatever that's you're familiar with.
Okay. Sitra, if someone were to come to you, what would you recommend?
Same thing like Azah and Dr. Alvin said, but probably you just need to ask yourself. It's very important to ask yourself what keeps you happy. Like for me, it would be music. I could just listen to sad music and start crying, and that's okay. If I feel like happy, like just listening to happy music and start dancing, it's fine. Another thing they could do is like just having aromatherapy. Massage is really helpful. Just ask yourself, if you like writing, you're a writer, you like writing your thoughts out, write it. If you have to soak your feet in a warm water, go to a tub and soak yourself, go ahead and do it. Anything. Ask yourself what makes you happy. That's it.
Okay. Now I'm going to ask Dr. Kadir a little bit differently, because when I went to go see him, and I didn't go see him as a friend, I didn't go see him as a colleague, I went to go see him as a psychiatrist. And what's interesting, I went to him because I shared with him what I went and prescribed for myself, because I understand medications. And I said, it didn't work. It didn't work at all. And he said, well, good, that'll stop you from taking that. And I said, I know what I need. And I told him what I needed. And when he finished, he gave me advice. And the reason I want him to share with me, or with you all, the advice that he gave me is because very often people think that mental wellness is a this or that proposition. It's not either right and you'll be fine, or take sleeping pills. What I needed was, and I'll just say, I needed Xanax. I needed something to help me sleep, because at that time we had the COVID stuff going on. We had my immigration issues. My son had been arrested. I had a lot of stuff on me and I wasn't sleeping. So what I knew is that I couldn't just go to him and get pills. That it's not a this or that. So I think he's an excellent person to talk about what is a regimen. What do you recommend when someone comes to you? Because you don't just dispense drugs and say, you know, see you next week.
I don't. I read the chat. I think one of them, as mentioned, is recovery model. The recovery model is working with the people in front of you, being with them rather than working, rather than doing things for them. So understand what that they are going through, like what we did the other day, Indigo. And you said you needed something to help me with sleep. The rest you're going to do things fine. So that's why I guide you through. And Azah has mentioned self-care. I've mentioned self-care earlier on. Alvin has mentioned self-care. That's where we all start with. And self-care is the word itself. You can't prescribe it. I have tried teaching people mindfulness. You do that to youngsters, they come back and you see them in a blank face. They rather do K-pop dancing.
And that's fine.
Yeah. So it has to be individualized, actually. So that's self-care. But then I must reiterate the second part, where you try to get them in touch with their peers, either those who have lived experiences or their same age group. So we are professionals. We are sitting at the end of the table. We can understand our training to help us to know where they're coming from, but we cannot really emphasize them unless we have gone through the same thing. For grief, I can share my grief experiences with my clients who are having grief. But for hearing voices, I don't hear voices. For taking drugs, I have never taken drugs. Even for pain, I don't take Panadol. So I can't share that. So I can get in touch with, I can put them in touch with someone who does. So they have a different perspective. The third level is I'm talking about the people who can't afford services that they have to pay out of pocket. So the third level is where they can walk to somewhere, health center. We train people in the basic things that we talk about, some behavioral component, some cognitive components. They can get there and get some people to listen to them and provide basic steps towards getting better. If then they don't get better, then they see the specialist. So that's where I'm coming from. I'm coming from a perspective of recovery. When in recovery means you have to make the journey. I'll be there to help you, just like 100 meters. I'm outside, you are running inside the track. I'm outside, but running at the end. And with serious mental illness, I never let go. Never means never. It's lifelong. My patients started with me from 20. They're still bothering me when they are 50. Right? So it's lifelong. Serious mental illness is lifelong. For anxiety, I see episodes. It doesn't last too long, so I want you to be away from me after 2 years. I don't want to hear of you because you should get all those skills to make you well. Some depression, yes, they get it's episodic. They get limited times, and with skills that we teach, they should get well. Some type of depression, they do get recurrence. So even then, you give them the skills, like cognitive skills, behavior therapy skills. They should be able to live with their depression or overcome their depression with those skills. So you start them on a journey of recovery, understand that they are able to get well. This is apart from the serious illness. That's my perspective as someone who's uh, been involved in the community for very, very long time.
Okay.
So the perspective has changed, that we do things for you. That is the professionals, we provide team, we go to your house, send medication, send therapies. Now the concept is recovery. Okay, we do certain things together. Most of the things you do on your own. You will know what to do in the long run.
Okay, so I want to finish off this thought, and Dr. Krishna, I will be with you as soon as I finish off this thought, okay? We have a poll up there that basically said all have a stigma. And the one that had the least after all was counselor. So how do we change that? For instance, because I work in this space, I have no problem saying I went to Dr. Kadir because I needed help. I was not sleeping. Now, what's interesting, let me say this. I believe we all believe in the mind, body, spirit connection, right? That if I'm not sleeping, that's a body. And if I'm not sleeping, that's going to affect my mind, which is going to affect my spirit, or vice versa. So we all have no qualms going to see people when we need help. But what can we say to the audience? If there's such a stigma to go and see anyone, what do we do? Is there something we can say? Is it something that maybe the audience can say to their friends or their loved ones? What do you recommend, starting with Alvin?
Yeah, great one. Let me ask all of you this. Would you add me as a friend on social media now that you have seen and heard me? What do you think?
Yeah.
Sure, why not? Would you unfriend me if I told you that I went to see a psychiatrist and that I'm on medication and I have to go for further therapy with a psychologist, although I'm a psychologist myself? Would you unfriend me? Guess what? I've gone to see the psychologist as a client, as a patient. Why? Because I was burnt out at work. What does it say about going to see a psychologist? So the stigma is definitely going to be there. It's still there, but what we can all do is keep on talking about mental health and what we can do about improving mental health and what we can do about any kind of symptoms that may point to a mental illness. So I'm a psychologist. I go see a psychologist. Why? Because I know they are properly trained. They are professionals, and that the methods that they use have been shown again and again in research that are useful. Well, at least 70% of the time, but that's pretty good. Even drugs are not like 100%. So we know. And why can't I treat myself? Well, have you seen a dentist drilling their own teeth? So I would say when it comes to addressing stigma, keep on talking about it. And I would use that personal thing. It's like, would you still be friends with me? And, oh, of course I'll be friends with you because you're a friend. Those other people, they're different. How different can they be? And we also need to understand that mental illness has a face, and that face looks just like you and me. We don't know. We can just be kind. But I would really want to push for more understanding about the difference between mental health and mental illness. It's not just about emotions, it's about our brain chemicals. It's not just about doing one thing and you'll be okay, because there are a lot of things that we are not in control of. There's the biological side, the psychological side, which also comes from your own personal history. There's a social side that Dr. Kadir talked about earlier also, which is complete. And we also need to look into our research, information that comes from research, and they're all very useful. One thing I've learned is when it comes to mental health, one of the single most important factor to mental health is not your physical health. It's not even your wealth. So don't worry about money. But money does bring happiness only if you know how to spend it correctly. And it's your social health. We have learned from longitudinal research. This is from Harvard. 50 over years, they found that the single most important factor that contributes to your quality of life is your social health, your meaningful social relationships. So reach out, connect. No matter how disconnected we are because of the COVID thing, keep on connecting. It's very, very important. And this is why, again, behavior activation is so useful, because you're among people, you're among your own society, your community. Very important. So in order for the community to also accept you, we need to keep on talking about mental health. So I'm happy that there are so many of you here. Let's demystify mental health topics. There's a question also about hypnotherapy. All these are pretty, it's like mysterious kind of stuff. Let's go into it. But it's not that mysterious. It's just about how we relate to one another. Part of it is improving our relationships, not just between each other, but with yourself.
I'm glad you said that it's about talking about it. Just recently, I was at a pub and they were just talking about it. No one knew that I had a mental health background. And a gentleman turned to me as a friend, thought I would, jump on his bandwagon and said, Indigo, don't you think that someone that has mental problems probably wasn't raised right? I know, right? Like, no, I don't think that. So at any rate, yes, we got to talk about it. And when we hear people say things that are inappropriate or incorrect, we got to call them on it. We got to say something. I'm going to take it to Sitra. So what would you recommend? And then we're going to finish up with Azah. And then I can go and start asking questions.
Yeah. So you mentioned talking about it. Yeah, we all talk about mental health, but do we practice it? How many of us, go to a restaurant when we are ordering and we say, please, thank you. We don't even do that. In Malaysia, we don't even do that. No kindness. So I feel small things like that, you need to improve communication skills for that, kindness. Small things like that, like getting bullied in the office, in an organization or even hospitals and things like that. I broke my wrist and the orthopedic doctor, he just wants to see my wrist and he doesn't even care how I feel. So whenever I complain, he'll be like just making fun. Oh, you maybe did a lot of work, or, don't even think that probably I'm just going through a very bad time, breaking your wrist, not getting to do so many things can also affect you mentally. So I think among even professionals, like doctors, teachers, the way we communicate with people, we need to improve that part.
Okay.
Yep, that's it.
Azad, want to end this part with you, and then I'm going to go to Dr. Krishna to open up questions.
Okay.
Or questions.
Yeah, I kind of spaced out. So what was the question again?
Because everyone pretty much has a stigma associated with going to them, and you were the one that was the least out of all. What would you recommend to the audience of how to minimize that so that they can feel comfortable and courageous to go and get help?
I think courageous to come get help from mental health professionals is to be brave for yourself. Put self first. It's okay to put self first. It is not selfish. It is self-care. It is loving self. It is making yourself congruent so you can have a better life, so you can be functional in your relationships. So as a counselor, a part of our training too is to be counseled. In our training itself, we have a whole year of having counseling for ourselves every day. We needed to be the client first before we counsel other people. And I have continued that for the last 3 years. I had my counseling session yesterday, not because like Alvin, not because, I'm just looking after myself and my self-care. And so, yeah, putting yourself first is fine. Being brave to quit is fine. We're all there to help you. And sometimes around you, you might not have that support, but just putting that foot forward. We are here to help you.
Okay. With that, I want to go to Dr. Krishnan, and I'll probably have time for one other question. With us having 4 people, that's a lot of information. So we have things that we have to try to get out. So I don't want to run over your time. I want to respect your time. So Dr. Krishnan, what is your question?
Yes, Indigo. You have told us there are many different types of experts you could go to and see if you have a problem, but all of them cost money. And many times, as you have rightly said, there are many people who are sad, who are upset, who are depressed. They don't know where to go for help. I believe there's a Talian Kase 15999 which they could ring up. Now these people can't afford to see any of those on the panelists now here. You could go to a doctor and then get to an ordinary GP or a doctor, but those doctors don't have much time and experience to actually tell you what to do. These people have never even heard of self-care. They don't know anything. So when you're depressed and upset, if there's a number like 15999 who can help you or maybe direct you to somebody whom you can afford to see, that number 15999 should be made known to everybody in Malaysia, just like you know that if you meet an accident, you call 999. So this number, see, even I didn't know this number. I was just told the number on the chat group here. So this number should be made known so that the first number you call should be a simple number, not a 8-digit number. Simple number like that. You just call and say, I'm sad, I'm depressed. And then that person will advise you and tell you who to see. So how do we go about doing this?
Okay, so that number has been listed, but let me say this. When someone has a broken elbow, they don't say, well, my elbow's broke, so I'm just gonna wait until I get some free help. We have to legitimately see mental health as a profession, that there are doctors, there are counselors, there are therapists, there are psychologists that work in this, that are available. And just like a cardiologist, you know what I'm saying? You have specialists on the physical side, just like these are specialists on the mental side. And until we start appreciating that they went to school, there is a lot for them to learn. They have earned their degrees in this, that they are professionals that are available, just like there is free clinics, then there are paid clinics. Any thoughts from the panelists? Yes.
Yeah, I thought that was a very good point that Dr. Krishnan brought up. You see, the thing is, there are not enough of us in the panel. We can talk about mental health professionals, we don't have enough. And because of how people view professionals, there is also this sense of disempowerment. It's like only the professionals can do something, which I think is a shame, because if we only wait for the professionals to do something, firstly, the stigma remains, right? And secondly, not enough people get help. And yes, we are expensive. One of the reasons why I went back to university is because I was just too expensive. I felt really bad that people couldn't see me, couldn't pay me. And I wanted to do something about that. And part of what I wanted to do and what I'm doing now is to educate as many people as possible. So one of the things that we can do as a community is to get savvy, get skilled in providing mental health and psychosocial support. Firstly, before you can do that, you need to get better mental health literacy, which is what you guys are doing here, to learn more about what mental health is about, what mental health professionals do, and for ourselves to be skilled with basic level of competencies in providing help, providing support, mental health and psychosocial support to another person. And this is something that can be done. If you look at the World Health Organization, they've got manuals to teach you how you can do that, because these manuals have been used in refugee camps. There are huge, 100,000 people who at least, 20% of them have got some mental health issues. That's a lot of people. How do you help them without or with just maybe one psychiatrist, one psychologist. No way. But what you can do is can train other people within the community, very basic skills such as helping others to manage their stress, right? Like what Dr. Kadir was talking about, self-care, doing something for yourself, you know, to continue to recover, to know how to ask for help, very important skills that a lot of people don't have. And then maybe even better, teach others. So when we can have this kind of ripple effect, you have more and more people in the community getting access to mental health help, because there are too few of us, and if we are there, we are too expensive. The B40, the M40 will not be able to afford. Really, it's very expensive. You say clinical psychologists are expensive. Yeah, short term, long term. Psychiatrists can be very expensive too, because medication, if it is long term, medication is very expensive. You can get from government hospital, that's good, but you know, otherwise, whoa, more expensive than cigarettes.
Some medication is like a couple of $100 a day for a pill. And
There you go.
but they have great insurance to cover that stuff. Okay, so I can wrap up. Let me hear from Sitra. In terms of what would you recommend? I'll go to Azah and then in with Dr. Kadir.
Okay, so I think what, like mental health literacy, if you see NHS NICE, it's a guideline of what can you do, what, you know, they even tell you what the psychologist would be doing. If that would be a good thing for Rotary, maybe to start off with, guidelines, just having a website, having what to do, a self-care, what is self-care routine, like educating people through, you know, putting up on your website, and with like psychologists, what they have to do. If you go to the NICE guideline, they would actually, I don't even have to know if I'm going to a GP, if I'm diagnosed with anemia, I don't need to know what, I would know what medication actually she's going to give and what is the procedure she's going to do, blood tests and everything is literally there, the guideline. So I think we need to do that. Probably we can do that. And also, yeah, probably you can do that. And people can read that and see how they can help themselves.
Okay. Azah.
Well, I echo everybody, and Dr. Kadir must have something really juicy at the end of this, I'm sure. Somebody just said, KT, and she took the words right, or typed the words right out of my mouth, which was, what was that, KT? Mental health first aid. Is that right, KT? Yes, mental health first aid training. To train people to recognize certain things and to call them out and to be a support for friends. That's way back when with my mom, who's also a counselor. We did that in some MNCs in Malaysia, where we didn't give mental health training, but we gave counseling skills, listening skills, and what to look out for, and to be a support for other people as a peer support in the company for other staffs. And those people will also get once a month or once a week, something like that, that we'll give them supervision so they can unload on us. And then we can identify those people that need more help than the staff peers can help them. So yes, again, back to educating self, not only for yourself, but for others as well, for others, people in your family, your friends. I believe also, and listening skills. I think the art of listening is so, you know, people think that listening is just something that's not, that's easy to do. But when you really train in it and you really execute it right, you can actually do a lot of help to the other person. So train yourself and read a lot about it. The way to change is not only to speak about it here, but educate yourself so we can share and talk about it here, and so we can move on than just, you know, Dr. Kadir is probably hearing this thing for the umpteenth time over the last 40 years. And so has my mom. She has the same complaints. It's the same thing. Why haven't we moved on from that? Because it really starts from self. Really educate yourself. Let's move on from just, we need to do this, we need to do that. We need the how. We need the how from ourselves, and we need the how from everybody else. How do we get there? How do we get the talian up where do I go? So once we get over the fact that yes, we do need help, we can then do the how and when and where and how much.
Okay. Dr. Kadir, I want you to wrap this up with Dr. Krishna's comment in mind. What can professionals do? What can everyone do so that you all are more accessible, and there are people out there who can help that because a lot of people can't afford professional help, but they still need help.
Thank you. Dr. Krishna is right. The helpline is useful together with the other helplines, the Befrienders helpline, the Good Samaritans, but they are just that helpline. It means they're there for people to talk and someone at the end of the line to listen. I've started 2 helplines in Johor. It ended dismally because of interference. And I was involved in the UK NHS Direct, which was also not that very useful because people prefer to come and have face-to-face conversations. So that's where Alvin's idea of training people with psychosocial initiative, psychosocial support, and a broad-based support at the community level is a very interesting thing as far as I'm concerned. We all echoed the fact that everybody needs to have self-care, to practice self-care. I think this has to be a mantra from now on. Practice self-care, practice self-care, and practice self-care. And I think list down the simple self-care strategies. You don't have to say meditation, just say practice relaxation methods. So each to its own. Exercise, like Alvin says, and sleep. I cannot overemphasize. Now we know that you need to have a proper sleep-wake cycle routine. So that's self-care, and we have to now start identifying people with lived experiences who can then support those who are in need. So then I think that is the second strategy for this coalition. And the third strategy will be start to train more people to help those in need free of charge. That's number 1. I think that's clear. Number 2 is the stigma. You can't go home without thinking that stigma is the big issue. Stigma is the big issue. I think Alvin has touched about it. I've been saying this all along, that mental illness is a brain disease, right? That's the easiest way to go about it. Saying that it's a brain disease doesn't mean that it's just purely biomedical. The brain interferes in relationship. The brain interferes in emotions. The brain influences your behavior. So both Azah, Alvin, and Sitra comes in because it's the brain. It does everything. It's not like the heart is just beats on regular basis to supply blood all over. The only advantage the cardiologists have is that he can see the heart. Right? He can put a tube in and can visualize the heart muscles. We don't have that luxury for the time being. We do have PET scans that can see how you think. We do have SPECT scans that can look at emotions, but I don't think we need that. We know that whatever we do as a human being comes from the brain. And we know enough now that we can tell the brain to do other things. For example, there is a happiness center. You can do things to make yourself happy. I think we all know that. And we know, for example, now you can make new brain cells grow. That's something new. This is called neurogenesis. This is something very new. You can do things to make about 8 to 12 brain cells grow, and this starts in the memory area. So where,
but that's the whole thing, that in Malaysia we don't even have neuropsychology
exactly
or anything like that with the brain. But in the UK you have to study the brain.
3 neuropsychologists.
Yep.
We only have 3.
Yes.
Neuropsychiatrists know everything. They don't even learn neuropsychology.
Surprise like this. What I'm trying to say that we know this information, right? We don't need to reinvent the wheel. We don't need to have a brain research center here because we can't go there. We have not invested there. I am a member of the Malaysian Mental Health Council. Let me tell you, it took 10 years for despite the Tan Sri Lanka will know this, telling from the beginning, we need clinical psychologists, we need counselors, Okay, we need therapists, we need social workers. The bureaucrats are unable to took 10 years to decide, yes, clinical psychology is a separate field or specialty altogether. 10 years to decide, not minuted yet. I don't know whether it's minuted yet, Alvin. So from that time, from 16 for 10 years, we are 31.
Dr. Kadir,
1 minute.
stuff, but it's taken us all, and I got to wrap up because we promised them we'd be done at 9:30. Citi is here. I would like for her to, at a minimum, share about who we are, because some of the questions that are being asked, we're doing that. We have what's called a national coalition, and this third Thursday talk really should be almost like every Thursday, because there's so much to talk about when it comes to mental health. So we just scratched the surface. We're not going to change.
Exactly.
We're not going to change the world tonight, but at least we're going to give you. I hope we gave you enough information that you are comfortable picking up the phone or emailing someone that you need to talk to. Citi, are you available to speak on behalf of the National Coalition for Mental Wellbeing?
Yes, Indigo, I'm here. Well, great session, Dr. Indigo. Hello, everyone. I'm Siti Subaida from Rotary. And, as you have just seen or heard, we've got 4 professionals there, all of different background, counselors, psychiatrists, therapists, How do we put all of them together? I mean, you've just heard Dr. Kadir saying that it took them 10 years for, just to approve a particular profession. So the Rotary District Action Group on Mental Health Initiatives, which our district started in August, we actually decided to bring together all the professionals under one roof. And we call the National Coalition for Mental Wellbeing. That's the organization. And the key objective is just very simple, to bring them together and address all the issues that you have heard today. Some of these challenges that we face as a nation. And Rotary is taking this lead, of course, working with all the agencies. If you can see on this list right now, we are in the midst of formalizing this coalition with at least 30 over organizations, and every one of these organizations, from the Mental Health Association, MMA, the Bar Council, Faculty of Mind, both the NGOs, private sectors, even the institutions like HELP, IMU, Malacca, Manipal University, Utah, and world bodies like UNICEF, UNHCR, and WHO are all coming on board so that we can all work this together in one voice. Next slide, please. So in order to put this together, and we have sort of come up with certain strategies of the things that we need to address. And you have heard some of these from the speakers, things like youth and adolescents, some of these issues. Rotary and the coalition and Rotary, we are going to start looking at how do we train school counselors, what is the outreach like, whether training them as counselors or whether training them with mental first aid programs, basically to support youth mental health and providing access to aid. Where can they go? How can they help? I think Azah mentioned about how, right? That's the biggest issue. How can we help them? How can they help themselves, right? So for youth, it's like peer support. So these are some of the things that we would like to look into in reaching out to our youth and adolescents. Psychosocial support. I think this word has been mentioned so much in this session today. We want to perhaps reach out to the frontliners, the community health workers, providing the non-therapeutic intervention support. And again, mental health literacy. You've heard all these things in this session today. And this is where the coalition is hoping that we could address some of these issues. Stigma and discrimination, I think that's the biggest issue we have right now, and Dr. Kadir did touch on it, and I think he's also very, very passionate in this area. but how do we address it? How do we reduce the stigma discrimination in the various community settings, whether it's school, bullying in school, whether it's in terms of even reaching out to counselors is a discrimination, is a stigma, right? So how do we move from there? Workplace, that's another issue which I think with COVID-19 right now, this issue is really escalating. Employee mental health challenges, which a lot of employers are facing with the retrenchment and working at home. Working at home is not an easy thing to handle. It's another form of stress level. You'll be surprised the kind of stress employees go through working at home. Right, the output must be the same, but then they are in a totally different environment. Decriminalization. I think most of you have heard about the stigma of mental health issues, suicides. Right, how are they being criminalized? So we will be looking into this, and I think this is something that we be looking at more as a legislation matter and bringing it up to the right authorities. And we have the Bar Council, the legal aid, all in our committee to be able to help us in these areas. Task shifting, and I actually learned this from Dr. Kadir in our last session. Dr. Kadir, again, how do we actually empower non-physical healthcare people like us, recruit volunteers who can just be the listeners, how do we care for ourselves, how we care for the next person beside us? These are just people who could provide those community-based care and support. As rightly said by all our speakers, we do not have enough professional counselors in this country. We have so many areas of psychosocial sectors which we are not into it. But how can the people, the general public, the community come together and provide this support? And that's the role of this national coalition. We would like to bring together all the various agencies, Rotary, other NGOs who share the same passion, and how we can work together and move together. And even this issue about Talian Kasih, Rotary is going to work with Talian Kasih, but both as providing, promoting the line, at the same time through the support, our coalition members, to provide the back end support to Talian Kasih or the Ministry of Women and Family. And talking about ministry, the coalition is also engaging with the various ministries, Ministry of Health, Ministry of Education, Ministry of Higher Education, Women and Family, Multimedia, and we are putting all this into an exercise where we can work with these various national agencies, government agencies. So you will hear from our action group very often. A lot is being done by the action group. And I think the coalition itself, we are in the process of working towards formalizing it. And in months to come, I'm sure the coalition members will be very, very active. So that's all. Over to you, Indigo. If it's anything, I'm sure you will be able to chat, send us a chat or send us more information. And basically, this is what we're looking at as far as our mission, vision, and what value we run for. Thank you very much, and have a safe day, safe week. We are all going lockdown from tomorrow onwards until February, and that's another stress, being at home, not being able to work. Thank you so much.
Thank you. And as she shared with you, this is our mission, our vision, and the values. And I'd be remiss if I didn't share with you the power, the leadership behind this initiative. And these are the people who you may recognize, for those of you who are Rotarians. And this is the committee that brings you our third Thursday, and committee members as well, in DAG, MHI. And I want to thank each of the presenters for being a part of this. I showed you their information. Please get in touch with them. If you really believe that you need support in some way or another, you're also welcome to contact me. Here is a picture of the power behind all of this. So you may see some of these people on the chat or in the room right now. And we are going to close unless there is something else that I'm forgetting. Dr. Dixon, remind me. But otherwise, we are having a hard close. But we will
Let's keep some airtime for Dr. Raj, the chairman of this mental health initiative, to thank the speaker.
Okay, thank you.
Hello. Hi, Raj from Rotary Malaysia. I must say this has been a very fruitful session. Our 4 speakers have done a really marvelous job by speaking of their profession, what they do, sharing their ideas. I think they have given us a good insight on where to turn to when we do have a problem. The District Action Group, this is the Rotary part. We are initiating the National Coalition for Mental Well-being, as described by Siti. This is going to attempt to address all the shortcomings in this country. We want to work with all of you, the speakers. I think majority of the speakers are members of the National Coalition. So on behalf of the District Action Group, as well as the National Coalition, I'd like to thank each and every one of the 4 speakers from the very bottom of my heart. Thank you for being with us. I know this is a valuable time that you have spent with us. Like just now, I think Dr. Indigo had mentioned the American way, last but not least. Last but not least, I would like to thank our moderator, Dr. Indigo, for having done a marvelous job. The team that put this entire webinar together, headed by Dr. Dixon Lai, and this committee, thank you. Thank you for doing a marvelous job. And to the participants of this evening's webinar, thank you for inspiring us. When you attend, we want to do more. And please take home this message. The message, whatever knowledge that you have gained from this session, I think we've overshot a little bit, but please bear with us. Share it with your family and friends. You will never know who may benefit. So thank you very much. We look forward to your support. We are going to address as much as possible. Thank you very much.
Thank you.